Hi, I'm Dr. Sedano, the Director of Clinical Support and Education at Avexia Diagnostics. Today, I want to talk to you about diagnostic testing for female hormone balance. Now, dozens of health conditions are caused by hormonal imbalance, as you know, such as irregular menstruation, infertility, acne, thyroid disease, fatigue, and diabetes, to name a few. And some of the signs and symptoms of female hormone imbalance include irregular menstrual cycles, infertility, hot flashes, night sweats, persistent weight gain, hair loss, pelvic pain, fatigue, that coldness of the hands and feet, premenstrual syndrome, heavy menstrual bleeding, breast pain, and discharge from the breasts. Now, when assessing for female hormone balance from a blood testing perspective, the pre-built Avexia complete and comprehensive female hormone panels are the go-to blood test panels. Now, these panels were created to assess overall health by including the CBC and comprehensive metabolic panel, and of course, checking the hormone levels. Now, aside from measuring the major hormones such as estradiol, progesterone, and testosterone, these panels go further and they measure an array of other biomarkers that can be indicators of hormone balance, such as 17-hydroxypregnenolone, pregnenolone, androstenedione, prolactin, insulin-like growth factor 1, thyroid hormones, sex hormone binding globulin, the adrenal biomarkers such as DHEA and cortisol, follicle stimulating hormone, luteinizing hormone, and the markers of glucose regulation. Now, aside from the classic hormone testing, other critical biomarkers that I like to focus on, which are included in this test, of course, are follicle stimulating hormone and luteinizing hormones, and they are clinically useful to distinguish primary gonadal failure from secondary gonadal failure. Now, some of the causes of primary gonadal failure, or what's known as primary ovarian insufficiency, include autoimmune disease, cancer, hysterectomy, certain infections, prolonged exposure to chemicals, pesticides, and other toxins. Now, on the other hand, secondary gonadal failure is caused by disruption of the hypothalamus pituitary gonadal axis, which can be caused by excessive weight loss, exercise, stress, and numerous other conditions. There's another analyte I like to look at, and that is sex hormone binding globulin, which is produced by the liver. Now, this globulin, it transports testosterone, dihydroxytestosterone, and estradiol in the blood in their biologically inactive forms. Now, changes in sex hormone binding globulin levels can affect the amount of free hormone that is available to be used by the body, therefore it can cause hormonal imbalance. And finally, cortisol in combination with DHEAS. Now, that's going to provide significant information about adrenal function as well as immune system function, since, as you know, both of these systems are interconnected. And as you may likely know, DHEA is the precursor to testosterone and the estrogens. Therefore, the concentration of DHEA is going to affect the amount of testosterone and estrogens in the body. I hope this information serves you and your patients well. Until next time, I wish you all the best personally and in practice.